Hello, Mr. Richards.
Hi.
How are you doing today?
Good, how you doing?
I'm doing good. My name is Bianca. I'm a nursing student at MCC, and I'll just be going through a health history with you. This should take roughly 20 to 25 minutes, okay? Can you verify your full name and your date of birth for me, please?
Marcus Richards, January 14, 1990.
Okay, so that puts you at the age of 30. Okay, and then how tall are you?
5'10",
Okay, and then how much do you weigh?
292.
Okay, and your vital signs look good. I had a reading of 120 over 80. And would you prefer to be called Mr. Richards or Marcus?
Marcus.
Okay. And Marcus, what brought you in here today?
I'm having shortness of breath throughout the day.
Okay, and do you have any other health concerns related to your shortness of breath?
I think my weight has an effect on my shortness of breath.
Okay. So, Marcus, have you had any communicable diseases?
No.
Okay. Are you up to date on your immunizations?
Yes.
Have you received your pneumonia or influenza vaccination?
No.
Okay. And do you have any medication allergies that you know of?
No.
Okay. And then currently, are you taking any medications on your regular basis?
I use my inhaler as needed, and I think it's Ventolin.
Okay. And do you know what the dosage of that may be?
Um, I do not remember.
Okay, that's okay. And you said you take that as needed?
Yes.
Okay. And do you have any questions about your medications?
No.
All right. And do you usually take your medications as prescribed?
Yes.
Okay. You said only when needed is when you need your inhaler?
Yep.
Okay. Do you have any problems with any medications that are prescribed to you?
No.
Okay. And do you smoke?
No.
And do you drink caffeine?
Yes, I drink coffee.
Okay. And about how many times a day?
4 cups a day.
Okay. Do you drink alcohol?
Yes.
About how often and how much?
About 2 to 3 days a week, and that'll be 2 to 3 beers a day.
Okay. And those are about 8-ounce bottles or cans?
Yes.
Okay. And you said you drink beer?
Yes.
Okay. And then do you use any other recreational substances such as cocaine, speed, or marijuana?
No.
Okay. Do you have any food allergies or intolerances?
No.
Okay. And do you have any surgical histories?
Yes, I had a cyst under my left eyelid. The surgery was about 2010.
Okay. And you said it was a cyst?
Yes.
Okay. Have you had any hospitalizations or overnight stays?
No overnight stay, but I went to the ER last July.
Okay. And when you went to the ER, what did you go for?
I was having chest pains in my upper left side.
Mm-hmm. Okay. And have you had any accident or trauma histories, such as recent falls?
I had a car accident in 2013. I was rear-ended at a red light.
Okay. Did you sustain any injuries in the car accident?
Nope.
Okay. Do you have a family history of heart disease?
No.
How about high blood pressure?
Yes, I do. My mother has high blood pressure.
Okay. How about any history of stroke?
My mom's grandmother had a stroke last year.
Your mom's.
My mom's My grandmother had it.
Oh,
last
okay,
year.
okay. How about diabetes?
Diabetes runs on my dad's side of the family. He has it. My grandmother had it. My auntie Claudia has it.
Okay, and then how about respiratory disease?
Asthma runs on my father's side of the family. I have asthma, so does my little sister.
Okay, and then how about any cancer in your family?
My grandmother had cancer. I don't know what type of cancer. And my mother had lymphoma cancer.
Okay, is this your grandmother on your mother's side?
My dad said.
Okay, and you said um, you had asthma. Okay.
Yep.
And then so you have history of breathing issues.
Uh-huh.
Okay. And do you know when your last TB test was?
I do not.
Okay. How about when your last test X-ray was?
Last year in November when I went to ER.
Okay. So you said when was your last test X-ray? I'm sorry.
Last July.
Oh, okay. Okay. And then you also said that you had history of asthma. Okay.
Mhm.
And what does your usual daily activity look like?
We took my dog for a walk around the neighborhood and lifting boxes to kids at work.
Okay. Um, and how would you say your exercise tolerance is? Good, fair, or poor?
Or
Okay. Why do you say that?
I do not, other than work, I don't do anything else physical outside my daily routines.
Okay. Have you had any chest pain or heart palpitations?
Um, no.
You previously said that you went to the ER in July for chest pain, correct?
Yes.
Was it the only time you ever experienced chest pain?
Yes.
Okay. Did you experience any dizziness?
No.
Okay. And do you have any history of high blood pressure, leg pains, or cramping when walking?
No.
No. How about any history of heart disease, heart attack, or heart surgery?
No.
Okay. In 24 hours, what would you say that your breakfast, lunch, and dinner look like? So let's start with breakfast. Do you have breakfast?
No, I do not.
Okay. What does lunch look like for you?
It's usually a peanut butter jelly sandwich with some crackers on the side.
Okay. And then how about dinner?
It usually consists of red meat with white rice and a little bit of vegetables.
Okay. And then do you have any snacks?
Raw almonds throughout the day.
Okay. Um, and who usually prepares the food?
My fiance.
Okay. And then have you had any recent weight gain or loss?
I gained 11 pounds from last year's physical with my doctor.
Okay. And then are you satisfied with your weight?
No.
Okay. And then have you had any appetite changes?
Yes. I am hungrier now than normal.
So an increase in appetite?
Yep.
Okay. And then do you experience any excessive thirst?
Yes.
Okay. And then how much water would you say you drink a day?
10 or 12 cups a day.
Okay. And then do you know what My Plate is?
No.
Okay. So it is a tool that you can use to kind of orientate what your nutritional meal should look like for breakfast, lunch, and dinner. And it is provided by Michigan.gov. So you can go online and look that up. and just type in your information and it should detail a personalized plate. So this is normally, I'm sorry, what it looks like. Based off of this picture here, can you give me an idea of what your plate would look like for mealtime?
I'll say it'll be half white rice,
Okay.
about little over a quarter of red meat, and then the last fifth the plate would be vegetables.
Okay. And then do you drink any dairy?
No,
Okay. Are you experiencing any dental problems like bleeding gums, cavities, broken or loose teeth?
no.
When was your last dental exam?
Last year, um, July.
Okay. And then what's your dental hygiene routine like?
I brush my teeth once a day.
Okay. And then do you have a history of gallbladder disease or diabetes?
No, I don't have gallbladder disease, but I had gallbladder issues.
Did you go to the doctor for that?
Yes, I did. And
They said that you had gallbladder disease or gallstones or anything?
no,
Okay. How about diabetes?
no,
Okay. And do you have any difficulty eating, like chewing, swallowing, any heartburn, things like that?
no.
Okay. How about your bowel movements? What are those like for you? Are they pretty normal, frequent, infrequent?
I think they're frequent.
Okay. Like a normal frequency for you.
I think so.
Okay. And when was your last bowel movement?
Late afternoon today.
Okay. And those look fairly normal.
Yes.
Okay. So brown in color, shape to them.
Yes. Brown color.
Excuse me. And then have you had any recent problems or changes in urinating?
No.
Okay. And then how about any burning, pain or hesitancy with urination?
No.
Okay. Do you have a history of any urinary tract infections?
No.
Any difficulty in holding your urine?
No.
Any blood in your urine?
No.
Do you feel that you empty your bladder completely?
Yes.
And are you experiencing any prostate issues?
No.
Any hair loss
Yes.
on your?
My hairline right here, it's receding back a little bit.
Okay. And do you experience any dry scalp, dandruff, or scalp lesions?
Just dandruff.
Okay. Do you have any dry or brittle nails?
No.
How about any skin dryness, itching, sores, or any colored discoloration of skin?
I have dry skin behind the back of my kneecap.
Okay. Do you use any skincare products?
No.
How about sunscreen? And are you currently experiencing any pain?
No.
Okay. And what do your sleeping habits look like? About how many hours a night do you get?
4 hours a night.
And then do you take any naps throughout the day?
1 or 2 naps throughout the day.
Okay. Do you have any difficulty sleeping?
Yes.
How about any difficulty staying asleep?
No.
Do you use any sleep aids or medications to help you sleep? Okay. Do you feel like you have any specific limitations with mobility?
No.
Okay. And do you have any history of arthritis, back pain, or swelling?
No.
Okay. Okay. Do you wear glasses or contacts?
No.
When was your last eye exam?
Last year, it was towards the end of summer, so I'm assuming July.
Okay. And do you have any vision changes?
No.
How about history of cataracts or glaucoma?
Nope.
Any, I'm sorry, when was your last hearing exam?
Around the same time as my eye exam.
Okay, and then how about any hearing aids or hearing loss since then?
No.
Any ear infections or tinnitus, such as ringing in your ears?
No.
And have you had any changes in taste or smell?
No.
How about any feelings of numbness?
No.
Such as like in your hands or in your feet?
No.
Okay. Have you experienced any dizziness or blackouts?
No.
Memory changes?
No.
Any seizures?
No.
Do you give yourself a self-testicular exam?
No.
Do you use any contraception?
No.
You don't use any contraception?
What does that mean?
Like birth control type of thing? Like females usually use birth control. They have a birth control for men, but there's also like the condoms.
Oh yeah, I use safe sex.
Okay. Who is your support system?
My fiance.
Okay. And who do you live with?
My parents.
Do you live with your fiance?
She lives there too, yes.
Are you satisfied with your living arrangements?
Yes.
Do you feel safe in your environment?
Yes.
And what does your home environment look like?
I live in a ranch style home.
Are there stairs there? A single story?
Yeah, there's stairs to the main level to the basement.
Okay. And then do you have any pets?
2 dogs.
Okay. And do you feel safe at home?
Yes.
All right. And then on the scale of 1 to 10, 1 being the absolute worst and 10 being the absolute best, how would you rate your health?
I would say 5 out of 10.
Okay. And then what is the most important health goal for you?
I would like to reduce my weight to improve my breathing.
Okay. What do you do to be healthy currently?
When I can, I'll take my dog for walks around the neighborhood. And I'm trying to incorporate vegetables into my diet throughout the day.
Okay, and then what's the highest level of education you've completed?
Some college.
Okay, and then what's your current occupation?
I'm a warehouse associate.
And are you satisfied with your career?
Yes.
Okay, and have you had any major life changes within the past year?
No. I can say the pandemic.
It's hit everybody pretty
Yeah.
hard. Any other life changes going on with you?
I am buying a home. I'm trying to buy a home.
Okay. Any current stress, fears, or concerns for you? Could be for family, work, or financial.
Financially stressed a little bit. These due to the whole housing process.
Okay. What methods do you usually use when you're trying to cope with stress?
I try to surround myself with loved ones.
Okay. And then do you have a history of depression, mood swings, or anxiety?
Anxiety.
Okay. And what sources of hope or strength are there for you to kind of combat your anxiety?
I am not sure yet. I haven't brought that up to my primary physician yet.
Okay. And do you have any religious practices?
No.
And what would you say your greatest personal strength is?
Mental awareness.
Okay. And then, do you feel that you have control over your own future?
Yes.
what beliefs do you think would help your care, your health care, such as taking prescription medications or trying alternative medications?
Um, Something that I can do personally or like medically, like
Like medically, like alternative therapies, like herbal medications, prescription medications from a doctor.
I think prescription medicine.
Okay. And if a nurse says to you, "I'll be right back with your pain medication," about how long would you wait before calling the nurse's station?
25 minutes.
Okay. And um, who makes healthcare decisions for you?
Myself.
Okay. And what other areas of healthcare do you feel you have control over?
All of it.
When when you're sick, what kind of food do you like to eat?
Um, Chicken noodle soup.
And then who do you like to have close by when you're sick?
My fiance.
Okay. And how do you prefer to receive teaching information related to health presented to you?
Written and explained in person.
Okay, so you like to have it in writing and have it explained as well. And then, is there anything else that you'd like to add that we haven't touched on today?
No.
Okay, and then what is your ethnic cultural background?
I am African American and Laotian.
Okay, all right. Well, that completes my assessment. Thank you very much for your time. And I will just go and record my documentation, okay?
All right, thank you.
Thank you.